am here to present the 2021 budget for the Windsor-Essex County Health Unit. Annually, we're required to prepare and present a budget to our Board of Health for approval in accordance with the requirements of the Health Protection and Promotion Act and the Ontario Public Health Standards. This budget then forms the basis of our annual service plan and budget submission that are tentatively due to the Ministry of Health April 1st of 2021. Just as a reminder for all Board of Health members on how the WECHU is funded, the WECHU is funded in three different ways. Firstly, the Ministry of Health funds the WECHU for mandatory programs with a grant up to 70% of admissible expenditures. In addition, the obligated municipalities of the Corporation of the City of Windsor, the Corporation of the County of Essex, and the Corporation of Township of Peely provide funding at a minimum of 30% of admissible expenditures. Secondly, the Windsor-Essex County Health Unit receives funding at a rate of 100% for certain programs through the Ministry of Health. Those programs include the Ontario Seniors Dental Care Program, the AMOH-MOH Compensation Initiative, as well as other one-time business cases. Lastly, the Health Unit receives funding of $2.8 million from the Ministry of Children, Community and Social Services to support the Healthy Babies, Healthy Children's Program and the Nurse Practitioner Program. So our agenda today will look at the mandatory program budget, and within that, the Vectorborne Diseases Program budget, the COVID-19 Response Program budget, the COVID-19 Vaccine Program budget, the Ontario Seniors Dental Care Program budget, and we also touch upon the School Nurses Initiative. For the purposes of this budget, we will not be talking about the programs funded by the Ministry of Children, Community and Social Services, as that will be presented at a later time. Our mandatory program budget includes, for 2021, includes total admissible expenses of $21,251,673. This is comprised of salaries and benefits of $16.9 million and operating costs of $4.2 million. This represents an overall reduction from the 2020 year of $1,701,686. The changes in expenditures primarily relate to such things as a reduction of overall salaries and benefits. For 2021, resources that were previously budgeted for in the mandatory program budget were shifted to what we refer to as our COVID vaccination program budget. That shift is 29 FTEs, representing almost $2.4 million worth of salaries and benefits combined. As an offset to that, there has been an augment in certain other positions within the health unit, within the mandatory program, including system support, financial analysts, and coordinators to help with overall work assignments. If we maneuver through the other operating expenditures in the mandatory program budget, we look at the decreases that we see are notable in the office and equipment rental line and postage and freight line, $36,000 and $20,000 respectively. And those decreases are as a result of just reductions in program volumes that would have previously been there had COVID not been the primary focus of the health unit. The professional services fees caption of the mandatory program budget has experienced or will experience a net increase of $28,400. And there are two dynamics that are happening there. Firstly, dentistry services that we would have otherwise acquired in prior years has been reduced by $32,000, and that is because the WECHU has now hired a second full-time dentist. We have two dentists now that are dedicated to servicing the Healthy Smiles Ontario program, which is now cost shared, and in the Ontario Seniors Dental Program, which is 100% funded. As an offset to that, we estimate that we will have an increase in legal fees of $62,000 on account of certain labor matters for 2021. The program supplies budget is anticipated to increase $206,586 over the course of 2021 over 2020. And the increases are really driven by two areas. The Healthy Smiles Ontario program, we estimate there'll be an increase in program supply costs of $61,500. And additionally, we estimate $115,670 increase in information technology costs to help support the virtual footprint of the organization, in particular, given the increase in the number of FTEs we've experienced over the past year. Lastly, looking at the building occupancy costs, namely rent, building, maintenance, insurance, utilities, property taxes, telephone, security, and parking, we estimate that there'll be an increase in costs of $107,500 over the 2020 fiscal year. And those increases are really driven by increases in insurance costs of $118,000, telephone costs of $35,500, offset by a decline in parking costs of $55,500. As the board may recall, just prior to year end, we made a decision to discontinue our lease of a parking lot that was previously used to have our staff park.
Can I ask a quick question? Why is the insurance going up so much? That one just stuck out for me.
So insurance over the past year and with this last renewal, we've seen an increase in part because of COVID. So firstly, we had cyber coverage in the 2020 budget that was not of a sufficient level to satisfy certain agreements that we entered into in 2020 associated with the case and contact management software that the Ministry of Health put out for all of Ontario. So we had to augment our coverage there. So that was an increase in premiums. Likewise, there were other increases in premiums for other aspects of our insurance policies, in part because there are a number of questions regarding the implications of the health of the current pandemic on health units or other healthcare organizations. So there was pressure there. So there were two instances where we had to go to market for other insurers to get to look at insurance coverage. And we did that to make sure that we had the most optimal costing for the health unit.
Thank you.
If I may, Lorie, just on that too, on the insurance piece, to Judy's point, publicly funded organizations that are tied in with municipal governments and so forth are, whether it's our waste authority and many others, insurance costs are going through the roof. It's one of those things, and it's whether it's because of the climate change issues, the flooding issues, the cyber crime issues, and so forth, and less insurers are wanting to insure companies, and so we're having a very, very difficult time to find coverage and proper coverage for our municipalities and all of our agencies that are tied in with us. So this is not a phenomenon that's going to go away. It's becoming very difficult to insure, and more the carriers are leaving public sector organizations.
Unfortunate. Thanks, Gary.
So with regards to funding for the 2021 year, the mandatory budget, we are estimating that our funding will be $15,981,600 from the Ministry of Health. This is on the basis that we will receive a same or similar funding approval as we did in 2020. From discussions that I have had with the Ministry of Health and communications that we've seen in the last several weeks from the ministry, we understand that we will be required to submit our mandatory program budget plus budgets for COVID expenditures and our vaccine program as part of our annual service plan. And that the intention is to look at our total expenditures and not strictly our mandatory program budget, and look to see how much in excess of that $15.9 million the expenditures are, also taking consideration that the municipalities will fund 30%. So in effect, we should be, when we arrived at our contributions from the municipalities, we assumed that $15.9 million is our 70%. We grossed that up to include the 30% from the municipalities, which would equate to $6,849,257 worth of contributions from the municipalities. These contributions do not factor in any mitigation funding that we know that we've been approved for 2021. Such mitigation funding will be apportioned to the obligated municipalities during the 2021 settlement process to ensure that we've met all the eligibility criteria for that. The next budget that we're going to discuss this evening is the vector-borne diseases budget. Now, this budget is already included in the mandatory program budget. We do typically disclose the details of this particular budget on an annual basis to the municipalities for the programs that we run associated with West Nile virus, enhanced mosquito surveillance, and tick-borne diseases. So the total budget for these three programs combined is $418,386 for the 2021 year. This represents an increase of $96,000 over the 2020 budget. These three programs support 5 public health inspector students plus 1/2 a public health inspector FTE. Things to highlight are, for the enhanced mosquito surveillance, up to last year, we were in receipt of $25,000 worth of funding annually from Public Health Ontario. That agreement has come to an end. So now the costs of those programs are fully funded by the mandatory program budget. Additionally, when compared to the expenditures of last year, what we've tried to do in the current year's budget is truly align the costing of the programs with the budget. So for instance, in the prior year, we did not allocate 1/2 of a public health inspector that did very much spend their time overseeing the work of the public health students. In the current year, we have accounted for those costs, and that is roughly $49,000 of the $96,000 increase. Other increases that have occurred here are we've increased mileage, communication and awareness, and program supplies, as well as purchase services to align with the experience we had in 2020. So the next budget that we'll talk about is the COVID response program budget. So as reported in July of 2020, and because of the varying dynamics within Windsor and Essex County, we determined it was prudent to establish a COVID response team. The team that has been established for the 2021 budget represents 30 FTEs, 1 director, 5 managers, 9 registered practical nurses, 7 public health nurses, 4 public health inspectors, 1 epidemiologist, and 3 support staff. Things I'd like to highlight in regards to this budget are, in addition to the FTEs that I stated, the 30 I stated, there are 7 other FTEs that are being funded by a separate initiative through the Ministry of Health. So their salaries and benefits are not accounted for here, but their efforts are. Secondly, wanting to look at the most substantial costs associated with this budget outside of salaries and benefits or purchase services. As you can see, there's monies allocated for translation and interpretation of $82,000, case and contact management support, which represents the services of Global Excel Management, which were put in place just prior to year end, as well as costs associated with legal provision of just over $30,000. Our COVID-19 vaccination program, as indicated for the mandatory budget, in the mandatory budget program, we had transferred certain FTEs from our mandatory budget to this budget, recognizing that they would be in support of our vaccination efforts during the course of 2021. This COVID vaccination program contemplates 63 FTEs, 2 managers, 1 health promotion specialist, 10 public health nurses, 40 registered practical nurses, and 10 support staff. Just in the past few days, though, I will say that, again, the composition of the staffing will likely change depending upon the availability of that staff, of those staffing resources within our community. Additional things that I'd like to highlight in regards to this budget are the mileage costs that have been calculated here are calculated with reference to our staff traveling throughout the community of Windsor-Essex County to administer vaccine. Our program supplies, again, are all estimates of what we anticipate that we will expend within our vaccine administration program this year. I'd like to note that our medical supplies, one would look at our budget and suggest that our medical supplies should be higher. However, we are receiving vaccine administration supplies through the Ministry of Health when there is a transfer of vaccine that aligns with the vaccine that's been transferred. So we are receiving support there. Additionally, under purchase services, again, we would see Sharps disposals being quite high in the current year. Transportation costs, these are an estimate of costs associated with moving the vaccine throughout Windsor and Essex County on the assumption that we work with a model where a courier is involved with that cold chain distribution process. Translation and interpretation are also a party to this, and there's a provision of $20,000. And then certain other costs, which represent other subcontractors that were employed to help support the whole vaccination efforts. The next program that we'll talk about is the Ontario Seniors Dental Program. This is the dental care program that is funded at a rate of 100% through the Ministry of Health. This program here funds 11.5 FTEs, 1.5 managers, 1.5 dentists, 3 dental assistants, 3 dental hygienists, 1/2 health promotion specialists, and 2 support staff. Notable items for this budget are there has been an augment in salaries and benefits. We changed in 2020, we had a coordinator and 1/2 of a manager supporting this program. We learned very quickly at the beginning of 2020 that because of our hours of operation, it was prudent to have 2 oral health managers support all of the oral health programs within the organization, so that the position was modified to a manager position. So there was an incremental change in salaries and benefits there. Additionally, the 2020 budget had only 1 dentist. And again, looking at, after having 1 year's worth of experience, it was determined that it was prudent to hire a second dentist whose services then would support both the Ontario Seniors Dental Program and the Healthy Smiles Ontario program. And then the changes in the other operating expense lines were really to keep, it's basically to work within the context of the funding envelope. So we understand that the funding for 2021 will likely align with the 2020 budget approval of $1,674,700. So adjustments were made to the operating lines to ensure that we stayed within that budget. So the last piece that I'm providing as information only and not for approval this evening is the school nurses program. The school nurses program was established in August of 2020 to create capacity within each Board of Health to provide rapid response to school boards and schools in facilitating public health preventative measures to address for COVID-19. The school nurses initiative is funded at a rate of 100%, and there are 2 funding approvals that we have received to date. The first for the period of August 1st, 2020 to March 31st, 2021, totaling $1,273,000. The second approval spans April 1st, 2021 to July 31st, 2021 for a total of $627,000. We have not received any communication at this point whether funding will be extended beyond the July 31st date. We wanted to arrive at an estimate of what we thought an annual costing of salaries and benefits would be for that pool of nurses, and we determined that it was $1,898,658, and we're just presenting today as information only. Another thing I'd like to note is any sort of operating costs to support these individuals, for example, mileage, any professional development, any program supplies that these individuals require are going to be or have been and will continue to be funded as part of that COVID response budget. So the motion before the board today, after I address any questions, can be found on the last page of my report. This motion requests approval of the 2021 mandatory budget of $15,981,600 in base funding from the Ministry of Health and Long-Term Care, and contributions from the obligated municipalities of $6,849,257 from Windsor, County of Essex, and the Township of Healy. In addition, it requests approval of the COVID-19 response budget with total expenditures of $3,661,772. And it also requests the approval of the COVID vaccination budget with total expenditures of $5,873,949. Lastly, it requests the approval of the Ontario Senior Dental Care budget for total expenditures of $1,674,700. So if anybody has any questions.